Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery. So today I welcome you to the second lecture in the series Regional Surgery. Today we will be dealing with the teeth and jaw, surgical affections of teeth and jaw. In the previous class we have covered lip, tongue, cheek and palate. If you have not watched that video, I will give the link at the last of the video and also in the description. Do watch them after this lecture. Okay. So before going to the lecture, some formalities. Do follow me in Facebook and Instagram. Instagram is kind of more important than Facebook. I am not that regular in Facebook, but in Instagram you will get the updates regarding video. Also the PPTs I will be sharing in the image format in the Instagram. Okay. And one also announcement. You know that I provide notes, but this time I will not be providing notes because I have very less time nowadays to make all those notes, handwritten notes. So I will be sharing the PPTs only and the link to the books which we will be referring, whichever link I have that I will be sharing. Okay, so you have to make your own note during the classes. So these are the books which I am following. I will give the link of this permanent surgery and small animal surgery. I have the PDF in PDF format. Rest of the book they are locally available. You can buy or you can search in YouTube. In the Google, and you can get some links. So now coming to the basic anatomy of teeth. So first one is the enamel, this crown portion, this enamel, this is dentine, this is pulp cavity, this is the pulp cavity. Okay, here this is gingiva. Okay, and this is alveolus or the bone, alveolar bone. Okay, and this white with black dots, this portion, this is cement. Okay, cement, and the thing which joins the teeth to the bone is the periodontal ligament. I think here it is the periodontal ligament. These are the important structures that will come across while dealing with the surgical affection. Basic structure: enamel, dentine, then the gum or gingiva. Okay, then pulp cavity, cement, and the periodontal ligament. These are basic things which will the terms which will be repeated. Okay, next this is the dental formula of different species. You can note it down. Okay, next coming to directly to the surgical affections. First one is the abnormal number of teeth. First surgical affections, the teeth number can be increased supernumerary. Okay, more teeth. You see here regular 6, 1, 2, 3, 4, 5, 6. Okay, apart from that these are supernumerary teeth. Diminution means less number of teeth, very rare, may not be found. Double row incisors, it is found in case of horses. Okay, double row, this is one row, this is second row. Okay, like that double row you will find double row. These are developmental abnormalities of teeth. Okay, congenital you can say. Here there is extra 1, 2, 3, 4, 5, 6, 7. There is supernumerary teeth. Okay, next is irregular shedding. Irregular shedding simply means that there will be a deciduous teeth and there will be a permanent teeth. Okay, deciduous teeth will shed, then permanent teeth will erupt. But sometimes what happens, before it sheds completely deciduous teeth, the permanent teeth will erupt. You can see here, this one is the permanent, this one is the deciduous. You can see this milky white in color and they are slightly thinner and more pointy. Okay, here you can see this one. Okay, this is the deciduous, this one is the permanent one. Here you can see this is deciduous, this one is the permanent one, more thin and milky white in color. So this is irregular shedding, developmental abnormality. Next, abnormal position and direction. Sometimes what happens, some teeth may be in different directions. Okay, different direction, but I wanted to highlight two conditions, that is prognathism. The other word is pig mouth condition. Another one is brachynathism. It is known as parrot mouth. Okay, so in pig mouth the lower jaw or the mandible is much longer than the maxilla, in parrot mouth, the maxilla is much longer than the mandible. Okay, these are developmental abnormalities. Next, sharp teeth, shear mouth and dental hook. Sharp teeth, shear mouth and dental hook. What is sharp teeth? Let me show you in an example. Suppose this is the upper teeth and this is the lower teeth. It should be in exact opposition, but they are not in exact opposition. What will happen over time? They are not in opposition. This is the outer border of upper molar. Suppose this is molar, this is upper molar, this is lower molar. So this one is the outer border towards the cheek, outer border, and this is the inner border of lower molar, inner border, okay, towards the tongue. So what will happen? These things will go on wearing, wear and tear. It will happen. So over time, it will do? It will grow like this. Okay, here it will grow like this. So this particular edge will become very sharp. So that is known as sharp teeth. Outer border of upper row molar, inner border of lower row molar. When there isn't exact opposition, okay, slight deviation, then you will find sharp teeth. Next is shear mouth. Simply shear mouth, what happens? It is same as that, but here it will be much longer. So what will happen when it will open and close? It will seems like that a scissors, pair of scissors. This is one scissor blade, this is another scissor blade. So it will cut like this. Okay, so what they do? Simply they will injure nearby soft tissue, they will injure the gums, and there will be regularly bleeding while eating. Okay, this is basically shear mouth. Upper and lower molars overlap like the blades of shears or scissors. This is simply an exaggerated form of sharp teeth. When they are more exaggerated or more advanced, then there will be shear mouth. Next is hook, dental hook. What is dental hook? Let me show you an image. Suppose this is upper row, this is lateral view. These are teeth, 3 molars are there, upper molar. Now what will happen? The lower molar, here is 3, here is 3. Now the upper molar is overhanging and the lower molar is stepping back. Okay, the upper molars are overhanging, last lower molar project behind. So what will happen? During chewing, grinding, tearing, all those things when happen, this particular portion will be like this. It will be growing like this because it is not undergoing any wear and tear. Similarly, in the lower molars, it will go like this. So they will act like a hook. There will be a hook. Okay, so this is known as dental hook. Understood? So these are sharp teeth, shear mouth and a dental hook. Next is waveform mouth and stepform mouth. What is that? Suppose this is the molar, 3 molars, and their height is slightly different. So this becomes a wave. So this is waveform mouth. Stepform, simply a exaggerated version of the waveform. What will happen? Here the variation is very high. So this is stepform mouth. Waveform mouth, stepform mouth. Simply the height difference between the molars is different. Okay, so stepform and the waveform and stepform. Next is premature wear and a smooth mouth. Simply premature wear means before time it wears off. Simple, no complicated things. Smooth mouth simply means the dental surface. This is dental table. You will find different folds, or you can say different corrugations. But in smooth mouth there will not be any corrugation. The table will be very smooth. Okay, very smooth. That is smooth mouth. Okay, all the molars and premolars, they will have smooth table surface. Next, the important one is the dental tartar. So what happens in dental tartar? Basically it is deposition of different chemicals. So carbonate and phosphates of lime, magnesium carbonate, okay, organic matter like bacteria and mucus, all those will be deposited at the base of the, or you can say at the junction of gum and teeth. You can see here lot of dental tartar has been deposited. Okay, dental tartar is not commonly found in herbivores, while it is very much common in carnivores. Very rare in herbivores, but more common in carnivores. This is dental tartar. Mostly when they are not given any food which they can chew, these dental tartar develops. If you are giving boiled things or very smooth things which the animal can easily engulf, the dental tartar, you will find more cases of dental tartar. Home grown pets, they have more dental tartar than street dogs. Okay. Next, alveolar periostitis, you can also call it as periodontal disease. Periodontal disease. Periodontal disease. Alveolar periostitis simply means inflammation of the alveolus. Alveolar periostitis can be of two types, in herbivores, in carnivores, herbivora and carnivora. In herbivores, it has two forms, ossifying and purulent. Ossifying form and purulent form. As from the name, you can guess that in ossifying form, so there will be bony growths, exostosis, exostosis, exostosis. While in case of purulent form, there will be pus formation. In purulent form, there will be pus formation. Most common cause, the principle behind this alveolar periostitis is whenever there will be any cause which will cause the separation between the gum and the teeth, and there will be a gap, then the inflammation will set up. Okay, then this disease will set up. So what are the causes? In case of herbivores, the most common is the coarse feed. During eating, suppose in cattle, it is he or she is eating some coarse materials, okay, like straws or hay or like that, then it may have punctured those interfaces and causing gap. Then there will be alveolar periostitis. Fractures, suppose there is dental fracture or some minute jaw fracture or fissures, even some small fissures, those can cause alveolar periostitis. Suppose there is premature wearing, I told you, if it is so much worn that it has come up to the level of gum, then there will be alveolar periostitis. These are the reason. But in case of carnivores, I told you diet is one of the most reason. So dental tartar is the one of the most common cause of alveolar periostitis in case of carnivore, and that is more responsible towards the diet of the animal. Alveolar periostitis carnivora, also known as pyorrhea. The term is pyro. Sometimes they are asked in examination. So are simply they will find inflammation of the gum and alveolar socket. So all those things will be inflamed, and in inflammation we know that there will be swelling, redness and pain. All those things will be there. So this is alveolar periostitis. Next is dental fistula. Dental fistula you may find in case of horse also. So in case of horse, most commonly fourth upper molar, in case of dog, fourth upper molar, which is known as carnassial tooth, is involved, and it has very typical opening just below or lower to the lower eyelid, just below the lower eyelid. Okay, very common, and the term sometimes not commonly is known as pus in antrum. Condition is known as pus in antrum. Pus in antrum. Okay. In young horses, you will also find these things, but here the lower jaw will be involved. The carnassial tooth is in upper jaw and maxilla, while in case of horses, in lower jaw, first and second premolars, they are more prone because they have very long roots which go up to the lower border of the mandible. Okay, so first and second premolars, funnel shaped orifice in the skin, but it is more commonly known seen in case of dogs. Okay, very characteristics. You can see here the opening just below the lower eyelid here. Okay, the only solution is simply remove the carnassial tooth extraction. Next, clinical signs. Whenever there will be lesion associated with mouth, okay, you will find salivation. You know that salivation, queasing, dropping of food during chewing, queasing, imperfect grinding, who is supposed to be very small fragments. Suppose the herbivore is eating straw, then it should be in very small, okay, for digestion. But if it is having very long, the width is more long, or it has sometimes what happens while eating, They will not chew. They will simply put their food between the teeth and the cheek. They will store it there. Okay, imperfect grinding. Gingivitis, inflammation of gum. You will find swelling, redness and pain. Okay, foul odor, halitosis from mouth it will come. So these are the fundamental clinical signs of the oral lesions whenever there will be oral diseases. What are the most common treatments? Rasping. Suppose there is sharp blade or sharp teeth or shear mouth. Okay, in those cases rasping will help. So whatever portion, suppose this teeth has a pointy or you can say sharp teeth, then simply rasp it. You have to rasp it like this, then the tooth becomes normal. Rasping. Scaling, especially for dental tartar. For dental tartar you need scaling to remove the dental tartar. Teeth extraction in most of the cases of posinantrum or any alveolar periostitis, the connected teeth for which the alveolar periostitis is there, that teeth needs to be extracted. So depending on condition, most of the time tooth extraction if it is aggravated. Okay, you see posinantrum, in case of posinantrum, suppose in medicinal people what will they will give some antibiotic, it will heal, and after 2-3 days it will again come up. Sometimes what happens, instead of opening to the lower eyelid, it may get connected to the nasal cavity because it will eat those bones. Okay, the bones will get lysing of bones, and then it will open to the nasal cavity. That is more severe form. So all those things can be avoided. So for surgical management, teeth extraction for posinantrum. Next, one of the important things is oral tumors. Oral tumors. Okay, it consists of dental tumors as well as other like tongue tumors. We have categorized in one thing, that is oral tumor. Oral tumor can be malignant or it can be benign. So in malignant tumors there are a lot of tumors, but these four are more commonly found in pet animals. That is malignant melanoma, squamous cell carcinoma, fibrosarcoma, osteosarcoma. These are four major malignant tumors found in case of dog and cat. Benign tumors, epulids, you might have heard this one, very common. Epulids, ameloblastoma, odontoma, dentigerous cyst in case of horse, oral papilloma. So all those things we'll discuss one by one. First one is the melanoma, malignant melanoma. Most commonly it is found in case of dog compared to the cats. They are brownish color or black color, brown black color, firm and very vascular. All the oral tumors are vascular. Okay, locally invasive, it simply means if it is happening here, suppose in this picture it is happening here. Okay, this is a very small one. There will be very less time, in very less time it will invade entire mandible. Okay, locally very invasive, high rate of recurrence. If you will remove this one, another one will come up. And usually on gingiva you will find this tumor, not on teeth, mostly on gingiva. This is malignant melanoma. Next one is the fibrosarcoma. Primarily it is found in case of dogs. I think I have left one, squamous cell carcinoma. Yes, squamous cell carcinoma, it is more common in cat compared to the dog. Okay, and in case of dog, out of all the tumor types, this is the second most common tumor in case of dog. The positions where these tumors may be found is gingiva, lip, tongue and almost everything inside the oral cavity. It is very invasive, just like the melanoma. All the malignants are invasive. Fibrosarcoma, primarily it is found in dogs compared to the cats. Pink red in color, firm, smooth and multilobulated. This separates from the other structures. Okay, you can see here, this is one lobe, this is another lobe. Okay, multilobulated, pink red color. Sometimes you may confuse this one with the epulis, only histopathology can tell. Maxillary gingiva, most commonly it is found maxillary gingiva, hard palate. Locally very invasive and high rate of recurrence. Most of the malignant tumors are locally invasive and high rate of recurrence. Next one is the osteosarcoma. Osteosarcoma, very big tumor, very invasive, highly invasive, high metastatic potential compared to the all tumors. Okay, osteosarcoma. Next one is the epulid. This is one of the benign one. Okay, all previous ones are malignant. This one is the benign one. Epulids arise from the periodontal ligament. I told you, which the holds the teeth to the bone. That is the periodontal ligament, arises from periodontal ligament. Fibromatous, it can be three types: fibromatous, ossifying, and acanthomatous. Simply the matrix is different. Fibromatous is fibrous tissue, ossifying is the bone, that is osteocytes, and acanthomatous is squamous cells or epithelial cells. Sorry, epithelial matrix. Epithelial matrix. Among these three, acanthomatous is very invasive compared to the other two. Very invasive. Next is the ameloblastoma. Ameloblastoma, it is mostly affects the younger dogs. Okay, arise from dental lamina. Most commonly you will find in rostral mandible, locally very invasive. Okay, and next one is the odontoma. As name suggests, arises from the bone. Okay, dental follicle. Next one is a dentigerous cyst. Most commonly you will see in case of horse. Okay, so what happens? Teeth embedded in cyst wall. Sometimes while erupting on erupted tooth, around that a cyst develops. Okay, that is the dentigerous cyst. You can see here after extraction, this is the teeth and here is the cyst covering. It is broken. Okay, but you can see some soft tissue attachments here. So here is the cyst. So in case of horse, you can find at the base of the ear there will be swelling. Okay, cystic structure. You simply have to cut and remove. You can find a teeth and simply extract that teeth. Okay, dentigerous cyst. Next is the oral papilloma. Most commonly, you know that oral papilloma is caused by papilloma virus. Papilloma virus, most commonly it affects the young dogs. Multiple, okay, cauliflower like multiple gray white structures. It has a potential for spontaneous regression. If at all there is dysphagia, then surgery is needed. Otherwise it has spontaneous regression. Okay, next you should know that all the oral tumors are invasive. Most of them are invasive. So what will happen? You have to do two surgeries. If it is on maxilla, then maxillectomy. If it is in mandible, then mandibulectomy. I have already told about glossectomy. If it is in tongue, like squamous cell carcinoma can affect tongue. So when it will affect tongue, you have to go for glossectomy. And in case of maxilla and mandible, first one is the maxillectomy. So know this some terms. Okay, they are kind of difficult operations. If you want details of operation in the book Small Animal Surgery, there is procedures, detailed procedures. Okay, simply for education point of view, you should know these terms especially. What are the terms? First one is the hemimaxillectomy. Hemi means half, maxillectomy means removal of the maxilla. So this is hemimaxillectomy. Hemimaxillectomy, you can see those from the lateral view and from the dorsal view, all those things are been there. Yeah, this is hemimaxillectomy. Can you say what will be this one? This is rostral maxillectomy. Hemimaxillectomy. Hemi, half. Here both of this rostral hemimaxillectomy. Okay, so you can say that bilateral rostral hemimaxillectomy or simply rostral maxillectomy. Okay, both side rostral maxillae will be removed in this particular operation. Okay, or simply also there is another term, that is pre-maxillectomy. Okay, now here the central portion will be removed depending on which tissue or where the tumor is located. So this is central hemimaxillectomy. Okay, central hemimaxillectomy. This is caudal hemimaxillectomy. So these are the terms. Depending on the invading nature of the tumor, the part which you are removing, the term will come. Okay, first one is the hemimaxillectomy, rostral hemimaxillectomy, rostral bilateral hemimaxillectomy or simply premaxillectomy, central hemimaxillectomy, caudal hemimaxillectomy. Okay, understood? Similarly, the term is for mandible. Okay, similar terms is for mandible. This is the caudal Sorry, this is the rostral hemimandibulectomy. This is rostral mandibulectomy because it is bilateral, or rostral bilateral hemimandibulectomy. Okay, this is central hemimandibulectomy. This is caudal hemimandibulectomy. This is hemimandibulectomy. This one is the 2/3. Sorry, 2/3. One full, then 1/3. Okay, 3/4 mandibulectomy. Okay, so these are terms. First one is the rostral hemimandibulectomy. Rostral hemimandibulectomy. Next is the rostral mandibulectomy, or you can say rostral bilateral rostral hemimandibulectomy, or simply rostral mandibulectomy. Term depending on which portion you are removing, that you have to term that particular surgery. Okay, so these are two major surgeries for oral tumors. You have to know which vessels you will encounter during the surgery. For surgery of maxilla, you will find two vessels. One is minor palatine artery, another one is major palatine artery. Okay, minor palatine artery, here it comes and it joins the major palatine artery. Major palatine artery comes through the palatine foramen. Here will be palatine foramen. These two vessels you have to encounter. For mandibular artery, okay, it comes from the angular process. Okay, here there will be a foramen on other side. This one is the outer left side, or you can say this one is the lateral side. On the medial side there will be a mandibular alveolar artery, there will be a foramen, and here there will be mental foramen. You have known while discussing the mandibular alveolar block in the regional anesthesia or local anesthesia in large animals. So mandibular alveolar on the medial side, while the mental is on the lateral side. Okay, so these artery you will encounter. Rostral mental artery, here a small foramen will be there. Rostral mental artery, middle mental artery, okay, caudal mental artery. Simply a blood vessel runs through mandibular alveolar artery and comes out through mental foramen. Okay, as simple as that. One vessel, big vessel, which you need to take care while doing the mandibulectomy. And for palatine artery, major and minor, for maxillectomy. Okay, so these two vessels you have to encounter during the surgery. Okay, now there is a small portion, that is jaw fracture and luxation. You see, jaw fracture and luxation, it is mostly part of orthopedics, not of regional surgery. Regional surgery mostly of soft tissue surgeries. But let us see some terminology we will see, but it is mostly part of orthopedics. So jaw fracture, there is some temporary immobilization for jaw fracture. If you are finding jaw fracture and you have to refer to the referral hospitals or subdivisional or district headquarter hospitals. So this is a mouth gag. Okay, you can make with tape muzzle, mouth muzzle. Okay, so you can make this tape to stabilize this fracture. You can use acrylic over the teeth. Okay, over the teeth you can you can apply the acrylic. Okay, you can involve most of the tooth. Okay, here canine over that the mandible is fractured, so over that the acrylic is holding through the teeth so that the fracture segment will not move. Okay, these are temporary adjustments. Permanent one are wearing, pinning and plating. Okay, or ESF also. So here the for maxillary fractures you can use wears. Okay, wear and rod combinations. Okay, here wears most commonly in maxilla and mandible fractures you will find use of wears. Okay, here one wear is used for stabilizing fractures. Remember, you can use teeth as support. Okay, here the canine teeth has been used for supporting this particular fracture line. Here for supporting this fracture line, two teeth, the premolar and molar, they have been used to stabilize this fracture line. Here are some fractures. Here some mandibular fracture also, the teeth is used as anchoring point. Okay, which will hold the sutures. Here the canine teeth is used for anchoring. So wearing, for a mandibular fracture different wearing technique can be used. Suppose there are transverse fractures, simple wearing, two wires are placed here. You can use one wire here, another wire involving the teeth. Okay. Here is one horizontal fracture, two wires are used. One horizontal fracture and the teeth as well as the bone both are used. Okay, wearing. Oblique fracture, simply you have done wearing, we have done some wearing. Okay, from picture you can see that how the wearing has been done. Okay, here is some, this is comminuted fracture, multiple fragments, so multiple wearing has been done. Okay, this is wearing. You can also use plates. Most commonly reconstruction plates are used because they are very versatile. It can go up to 100 holes, so you can cut down up to your desired length. You can bend it, you can rotate it. Okay, like it will bend like this, it can bend like this, it can bend like this. Okay, very versatile. Those can be used for stabilizing the fracture. You can use plate and wire combination. Okay, plate and wire combination you can use for managing the mandibular fractures. You can also use ESF, external skeletal fixator. Okay, ESF can also be used for stabilizing these are ESF. This is, can you tell me which fracture is this? This is comminuted fracture. Okay, this is also comminuted fracture. Comminuted fracture, mostly ESF is good. Okay, so these are basically the management of the fractures of jaw. It is mostly part of orthopedics. Okay, they are, you should read detail, but remember in the small annular surgery, I have taken these photographs from that book. If you want to learn these particular surgeries bit by bit, then you can refer this book. Okay, otherwise the class will be unnecessarily long. Okay, simply you see, sometimes you have to know what are the procedures are there. Then when the case will come, you can refer the book, search the procedure, then do the surgery. You don't need to keep everything in mind. Okay, you should know that where to find them. Okay, and there is no shame in referring to books. Okay, some surgeons say that it should be on your mind. It does not work like that. Okay, remember whatever necessary and always remember where to find which things. That you should remember. Then whenever time comes, whenever there will be necessity, simply go to the book, refer it, do the surgery. Be confident in yourself. Okay, so this is all about the jaw and the teeth. Next we will go for the nostrils. Okay, nostrils and all those other things around them, upper respiratory tract mostly. We will be dealing with that. Okay, so till then, tata, bye bye, take care.